Hello, and welcome to a new edition of Education is Best Medicine. And thanks for watching. And remember, community public access is your best bet. Believe Radio, 24-hour inspirational gospel station. I want to thank Curtis. I want to thank Adamology for coming down here and bringing his family as well as his mother and Nanchow, kind of helping open up the studio for me. I'm just kind of what's on my mind, and just a collection of things I think. And I felt like the president, when they asked him was he going to invade the country, he said he was thinking about it. We're gonna have a lot of that, so don't worry. Well, and November is an interesting month in 2025, and I know we've been talking about the Epstein tapes, but I think the healthcare issues are what's on the table for me, and we'll talk more about the Epstein tape. But again, what's on my mind? And I think that I really want to remember this data and statistics as it relates to African Americans and their plight, and what's required. And so we have to have these kind of conversations. And then, first of all, I will continue to say that the Affordable Care Act, that's what it's called, not Obamacare. He didn't do it by himself. He had an entire legislature and had to go through the process, and some things they got, some things they didn't get. But the issue was to, again, allow for health care for those that had not had access. And what you have to understand that what was going on prior is that sick people just went to the emergency room and crowd the emergency room. And so folks that had real issues might not be able to get in because folks were being seen for primary care problems because they had no doctor, they had no insurance. So the expectation was where were they supposed to go? Again, lack of health insurance that requires a bankruptcy is one of the leading causes of bankruptcy in California and the country. America's a society of distractions. And so instead of us focusing on the Affordable Care Act, we're focusing on Epstein tapes. Important, but I think the Affordable Care Act and lack of affordable insurance for communities that I've taken care of in my career that did not have access and soon had access has become an issue. And I don't understand what the issue is because it's going to cost more to have them get sick and inundate the tertiary system, which is the hospital and the community hospital system and the nursing care homes, as opposed to addressing the problem before it gets that big. I think the data shows that and the information shows that. And again, we can have a discussion about that. But again, the big issue with this is that the subsidies that allow people to afford healthcare are going to be and were removed in terms of the this current administration and this current budget, and there's no discussion. So at that time, a bill becomes due like anything else. So let's talk about the bill that will happen in America. And again, you'd have to be living under a rock not to hear about the request to release the Epstein tapes and what that means. Epstein was just an individual, but there was a whole system, a whole trafficking system, a whole ability of the rich and powerful to evade justice. And that's what the concerns, what the issues for the victims or the families, for what this has turned into. And we'll add some information about that because this was a self-inflicted wound. And we'll talk about that in terms of why we're at this point now. Again, this is, I believe, Radio, 24-hour inspirational and gospel music station. George Pearson, I'm a physician's assistant, and this is Education the Best Medicine, under the umbrella of Eyes of the Conscious Soul. Miss Barbara Howard and her family are and she is the management component of this, and deals with administration and all those things. And as well, she's out of town. Family, again, family. She's strong on family, and doing things with the family. So they're out on an event, and wish them well and to have a good time and be careful and come back safe. But that being said, I want to kind of understand what the effect of the loss of subsidies would be, particularly in California, particularly in the Bay Area. And so I asked that. So the formation of these talks are a combination of GPT chat, open evidence, up to date, and try to support them factually to ensure that we gain the best evidence we can that is current, and as much as we can limit the bias in them. So I asked a general question to GPT chat. Open evidence in regards to what would happen if the ACA or the Affordable Care subsidies were removed. And since if the ACA subsidies were removed, health insurance, particularly in California, premiums which you pay, including the Bay Area, would increase substantially. So understand that whatever you're paying now today for your health insurance, that's all going to change at the first of the year, because these subsidies will no longer be funded. And that's been the big discussion about to fund these subsidies and not fund these subsidies, because a number of people are going to lose their insurance because it's simple as that. So we understand the premiums by which we pay insurance, but to everyone, would substantially increase, with out-of-pocket premium costs rising by an average of 79%. In a dollar amount, that'd be about $700 a year. Now, that's just for enrollees. For the single, elderly individual or family, annual premiums could reach thousands of dollars, making coverage unaffordable for many and leading to significant coverage losses, and thereby those individuals on the doorstep of public health, those individuals on the doorstep of the Kaiser Sutter systems. Because in California, if you come to the emergency room, you can't be turned away. You need to be stabilized and then move forward. Now, that's what's happening now. I don't know what's going to be the result of that. So we'll have to stay tuned. I need to get a document on my bag. So, so the big picture of the summary is that we won't be able to afford the premiums, thereby loss of insurance, thereby having to go to a system already overburdened and understaffed and underpaid. And I'm talking about the public healthcare system. And the public healthcare system is not public. It was, to me, a discussion about how can we delay care, not provide care. And subsequently, they came out in COVID where a lot of providers that were should have been here now decided to retire. And that's another story. For a senior elderly individual ages 55 to 64 in the Bay Area, historical data shows that before the American Rescue Plan Act expanded subsidies, half of nearly elderly individuals paid at least 18.9% of their income. For the lowest cost bronze plan, in dollars terms, for someone with a $40,000 income, if you got that, this would mean premiums of $7,560 a year. You got that? So, before the ACA, if you were 55 to 64, because after 64 you can get Medicare, but the 55 to 64 group that were the working poor, basically making $40,000 annual income, this would mean the premiums would be 1/4 of their income, almost $10,000. Might as well say $10,000. So 1/4 of their income If they made $40,000, at least $10,000 that's going to healthcare, because that's just the healthcare. We're not talking about getting the medicine. We're not talking about the ride to the doctor. We're not talking about the specialty care. This is just basic. That's why it becomes a problem, and that's why it hasn't been discussed, because the math does not look good, and it has not looked good. So without subsidies, premiums could easily exceed $600 to $800 per month for older adults. You're making $40,000, and all of a sudden, you go from an affordable plan where you can pay for your insurance to something that takes so much that you can't afford to pay it, $600 to $800 a month, and that's an estimate. For families, the impact is even greater. For deductibles for silver plans without subsidies, were worth $3,000 for individuals and $6,000 for families. Since 2016? So what family could afford that? That's in 2016. We're in 2025. So times two, right? Double up. Nipsey Russell had a song called "Double Up." I'm listening to Nipsey Russell. He was I miss Nipsey Russell because he was taken from us by a violent act, a cowardly violent act, and I'd like to send out an apology and thought of love for Coach Beam's family of Laney College. As the reports come out, we'll find out that he was just murdered in cold blood, sounds like. He was a coach. He was a mentor. I went to Laney College. Barbara graduated from Laney College. So it's a community college system that has fed a lot of us education and allowed us to grow and learn. And some of those folks got their dreams fulfilled on Laney College football field. Coach Beam was a medical director. I was the athletic director, excuse me. And so for him to be murdered on the field that he worked in, the school that he worked at, is just totally incomprehensible for me. Of course, they found who they believe is the shooter, and we'll find out. Seems to be some discussion around his relative or brother or friend or being kicked off the team. So this individual decided to exact vengeance on Coach Beam. And so we wish the family the best and his healing. Let the community heal. A lot of the players and family members are just devastated by this. He had a lot more to give. Like my grandchild, she had a lot more to give. If you don't know, my grandchild, Jamie, was taken by gun violence a couple of years back. Shot in the chest 4 times. So gun violence touches everybody. Respect for human life touches everybody, or lack thereof. That's why I see in the rollback of these subsidies, it's a lack of empathy and care for someone that has less than you. Can you imagine why somebody like that would be having so many problems? We'll talk about that. This is a Believe Radio, 24-hour inspirational and gospel music station. I'm George Pearson with PA. Been practicing about almost 43 years in community and internal medicine family practice. Community health care. That's where my wheelhouse is. So imagine $3,000 for individuals, $6,500 for families, and that's the cheapest plan. That's the bare bones plans. But that was in 2016. It's much more expensive now, to the point of, I would say, unaffordable. Enrollment could drop sharply with millions losing coverage. The Congressional Budget Office projects that 6.9 million few people will be enrolled in the ACA market plan, and 3.4 million more would be uninsured if subsidies expire. The financial burden would be especially acute for low in middle income households who would face high burdens likely to delay or forego care, which what happens, right? Sick people get sick. They can't decide, am I going to pay my rent, my mortgage, or am I going to buy medicine? Easy choice, right? No, it isn't. And that's the choice we're having people to make. So the summary is removing the Affordable Care Act subsidies would dramatically increase premiums and out-of-pocket costs in California, making coverage unaffordable for many, especially older adults and families, resulting in substantial coverage losses and death and disability and trauma. So I asked again, I said, let's go a little deeper because we need to go deep so people kind of understand what they're dealing with. The loss of the support of subsidies, ACA, will bump up the premiums for families, single family head of households to a point of unaffordability. And the question you have to ask, and the question that all these legislators ask, where are people going to go? What's the solution? I heard Speaker Johnson say, well, we've got many solutions. Well, I haven't heard one. Have you heard one? Have we heard one? Did they present it before they decided to chop it out of the budget? And we have a commander-in-chief that says he's not worried about affordability. He was before. We'll talk about that too a little bit. So the loss of subsidies result in out-of-pocket expenses. I told you the out-of-pocket expenses, right? Which directly impacts access and utilization in California. When subsidies are available, most enrollees report they are out-of-pocket expenses do not affect them seeking care or medical care. However, those with plans with higher cost assurance, such as bronze plans, which would be more common without subsidies, are significantly more likely to delay care. The delaying of care, the delaying of chronic illness, the delaying of follow-ups, the delaying of the eye exam, the delaying of the blood tests, the delaying of the liver studies, the delaying of the refills of medicine, that will have its own cumulative cost. I live and breathe this. I understand it. One of the questions I've always asked my employers, you tell me how my patients are going to get to my appointment, I'll tell you if they're going to make it. Simply put, if they get a ride to my appointment and the family member is available, they're more likely to get to my appointment. But if they don't have any transportation, they have to take 3 to 4 buses, and in some of my cases, bring family members with them, then they're not going to make it. And where you'll see them is in the ER, in the hospital, or unfortunately, in the morgue. So just think about, I'm talking about adults. What about the children? What about their ongoing clinical visits, vaccinations, well child visits, that kind of thing, sick care? What about the children? If you didn't think about someone like me in their 70s, but think about the kids. What is that going to do? How would that impact them? If a mother can't take her child to see the doctor without bankrupting themselves. It's always been dollars and cents, follow the money. And it tells you where the country's priorities are. It tells you this administration's priorities. You can deny children health care, but you don't want to protect those children from a predator. 75% of Americans voted for this present administration. Now that the shine is off the car, you see 2025, the playbook moving in and almost done. He's almost done. The hulling out of the Department of Justice, the hulling out of the healthcare system. We'll see how that plays out. It's not going to play out the way people think it is. In summary, removing ACA premium subsidies would likely result in more delayed care, poor chronic disease management, and increased risk of adverse health outcomes for Bay Area, California residents, especially those with lower income or chronic conditions. Again, empathy. Understanding that what you do not only affects you, it affects everybody around you. And which brings me to the Epstein files. And I asked the who, what, when dialogue about sex trafficking, and who made all this up. Was it campaign promise from the president administration? Was this a part of the Trump campaign? Because people need to be clear about that. Did this just kind of like come somewhere and people just decide they were going to focus on this, and from we're going to lock them up, we're going to uproot all the predators out of the government, to nothing to see here. So I have Miss Bondi's case, there were files on my desk, and all of a sudden, nothing to see. Let's talk about that. And I want to give a shout out as I begin this piece to Marjorie Taylor Greene. George Pearson, PA, why would you bring up Marjorie Taylor Greene? Because when people stand on the side of the right, I have to respect them. Regardless of what I think. And for her to stand up, I have to be a fervent supporter of the present administration, to take basically a bullet, because now they're talking about from the most loved female who supported Trump through all his stuff, and vice versa, one hand washes the other. Now, death threats because she wants justice for the victims. Empathy are gone. Honesty's gone. And the question is why? Because that's the constant question I get. So why is there not an ability to release these files? That's the question that you have to answer. That's the question we all want to know. And only a few people know. And I think she's right and spot on this. And I want to publicly thank her. Marjorie Greene on my show, but I have to be, because she's taking the hit for wanting the truth, right? So let's talk about this. I asked GPD Chat, and it says during the 2024 campaign, Trump explicitly promised to declassify or release the Epstein-related files. Key figures in this circle was Kash Patel, Pam Bondi, made public suggestions suggesting more transparency coming. So the president says he's going to release it. His top lead FBI says he's going to release it. So first, they must exist. Otherwise, you would say, oh, there's nothing here. But remember, you said there was something here. And then there was nothing here. Man, where do the delusions and voices come in? Because either that's bipolar or schizophrenia, hallucinations, psychosis, because you can't have your cake and eat it too. Or eat it too. And so, but when some of the documents were actually being reviewed or pushed for release, Trump shifted his tone. At times, he called the demands a Democrat hoax or fake. So how does something go from being, again, I want you guys to follow my thinking. That's why I have to talk about this, because I really tried to follow my thinking to say, maybe I'm looking at this wrong, because intelligent people should be able to say, man, I'm not clear about this. I need to go back and look at what being said and how it's being done. So I'm clear about the facts. And I like the readership and listenership and those that I'm blessed to say, hey, I heard what he's saying. He talks okay. Understand that. Why would he want justice for the victims? Why hasn't he apologized? Just as a person in power that says, gee, I'm sorry this happened to you. That's what was being said on the talk shows and all this kind of stuff. Okay. And I think about, I don't know why you wouldn't. Just to be supportive. Well, remember, he has been accused of a few things that are inappropriate. He said a few things about women's bodies that are inappropriate. And the American people knew what they were getting when they voted for him. Because he had told you, he had said it, he had acted it out, we had seen it. That's what the issue is. Is America have blinders on? Or in his case, just be selective in who you want to attack and who you don't want to attack? Because in all this discussion, he's not. He says we're going to look into this. We're going to find out. And well, his name is on all these papers. Then he should be investigating himself first, right? Maybe, but no, because in cognitive dissonance, it means nothing to him. That's for someone else. The laws are for someone else, and Supreme Court has given all that. So the second issue they said were the Democrats in congressional oversight investigation. Several Democrat lawmakers have pressed the files. For example, Jamie Raskin and 15 other Democrats sent a letter to the AG Pam Bondi Manning, released the documents that reference or implicate Trump. In 2025, the Trump-Epstein Files Transparency Act was introduced into the House of Representatives by Rep. Ro Khanna. There is also a discharge position that, as of last count, has been approved. 218. So this is going to be a mass. It's going to be a mass exodus of folks not wanting these files released if you're a political person. So what does that mean? Up until the time you have to say you're for protecting pedophiles versus not protecting pedophiles, that's the stance you can have. How about openness in government? How about transparency? How about all the things you promised when this went down? Oh, they were looking for Obama. They were looking for just name somebody. They were really looking for Obama. They wanted him to be on the list. And he was with his wife and children, minding his business. Oh, Clinton's in it too, huh? So what I find is that, when you're doing something that you know you're not supposed to do, you want to shed the blame or you want to cast him. He's been great about deflecting this, but this one is not working. And we need to understand why it's not working, because 75% of people voted for him. And there's still 22 to 33% of people still vote support him, regardless. This is where he walked down Fifth Avenue and shoot somebody. Other voices of human blood purge. Survivors of Epstein abuse are also pushing for full release. The Democrat National has also run a digital campaign targeting Republicans, accusing them of trying to bury the truth about Epstein. So, if I were him and didn't tell no tales, right? Epstein's dead. Then what's your options? Your options are to delay and deflect, but it's just not working. So subsequently, in the next week or so, there's going to be a vote on this discharge position, because I already have 218, and the people they were trying to manipulate to remove their names or not to sign it, they are not doing it, because that train left the station a long time ago. It did. So what's the take home is here? In 2024, Trump makes the campaign promise to declassify the Epstein file true. Early 2025, the DOJ under Panama released a first phase of declassified Epstein documents. True. What should be added also is they went to the Epstein estate and got all these letters and Trevor Chosen things that you would have thought that the Department of Justice would have had if they'd done a complete investigation. They tried to bury it. They don't even need to go through this. The current administration, President Trump can sign for a full release of the records. He chooses not to. And the question you have to keep asking is, why does he choose not to? That would sell it. And if his name is in some places that it shouldn't be, it would come out, but it would be for the people to review. So the people aren't intelligent enough to review. The people don't have enough understanding to see right from wrong. The people don't deserve to understand. That's not a decision they should make, because that's what he's saying. He's saying it's a hoax now. It's a Democratic hoax. He's now at odds with Marjorie Taylor Greene. Why? Because she wants the truth? Man, this administration works on a lot of different kind of mental games. You can't be for the truth when you ain't. You can't just attack your enemies. If your name is on the list, don't you think you should be investigated? Oh, no. That's for somebody else. And the question is, what happened? Because if you're not bringing forth a discussion about, I didn't do this, he never says that, didn't say that. He says it's a hoax. And it's nothing to see there. Not that he didn't do it, not that this is all a lie, and that he's never had intimacies with young children girls or young children boys. That may be the discussion we have to have. And we have to keep the pressure on, because this is a administration that wants to attack Venezuela before they release the Epstein files. And I said, was it a part of Trump's Republican campaign, and why now? Campaign promise. Trump promised to release Epstein's file was appealing to parts of his base, especially those who believed there was a deep state or elite cover-up, saying he would release them trapped and tapped into a broad narrative about transparency, exposing elite, and holding the powerful people accountable. Now, isn't that interesting? That's what he was saying in his rallies. That's what Charlie Kirk was telling him to do. That was the narrative. But the true narrative is what's coming out. Now, again, it wasn't going to happen what they thought it was going to happen. Because the last thing I think people need to assume is that American people are stupid, that they can't understand right and wrong. And if the most ardent in his base wants these released and he doesn't want to do it, then there's something there. And if not, let us see. Pull back the veil. Be transparent. Do what you said you were going to do in your campaign. You've done everything else. You wrecked the economy. So let's keep it going. I think the American people can handle the truth. I guess he doesn't think they can. Political leverage. For Democrats, pushing for the release is a way to challenge Trump and his allies, especially since those other files may mention or implicate powerful people, or at least that's the fear / hope among critics. Public pressure. Survivors and advocacy groups want transparency. There's a real demand from the public, not just political actors. Polling shows a majority of Americans want the Epstein files released. I'll read that again. Polling shows a majority of Americans want the Epstein files released. So if a majority of Americans want released and you don't want to do it, then you don't really want to listen to people that have elected you. You're not important now that you've been elected. That's not the way to run a government. That's not a way to run America. But 75% of Americans voted for him. So he's doing what he said he was going to do, and I don't understand what the problem is. This is what he said he was going to do. This is what they said they wanted to do. How do I feel about the shutdown of the government? Something had to happen. Something had to throw some light on this. So, are you better than you were last year? You feel your financial perspectives are better? You feel you can get a new job if you want to get a new job? Hey. Legislative 2, using a discharge position or a bill like the Epstein File Transparency Act is concrete to the force to vote, not just rhetoric. That's part of why this isn't just talk. Now, next week, we're going to find out who is in the camp of transparency and accountability and who wants to protect, as the legislature said, predators. It's just that basic. It's no more basic than that. Get your popcorn and watch, because somebody gonna blink. And this is not even process. Once they do the discharge position, they have to go to the Senate. The Senate has to prove it. And guess what? The president has to sign off on it. You think he's gonna sign off on it? Do you think presented with that document he was signing off, would it get past the Senate? But we need to know who's supporting pedophiles, so they can be removed from office. They need not longer to be representing us. According to the House Oversight Committee, Democrats reviewed 97% of the documents they received were already publicly known. So despite big promises, much of what has been released so far isn't groundbreaking news, at least for the base on their assessment. At least based on their assessment. DOJ Trump pushback. The Justice Department has said there's no client list for Epstein. Trump and his eye has shifted their message that started as a campaign promise, now gets framed as a political stunt, a hoax by opponents. Who uses that all the time? Who uses hoax? Who uses that word all the time? So you mean he was subjugating a hoax on the American voters and people, and he knew that to just get elected? So, no moral compass, huh? 75% of Americans voted for him. Legislative challenges. Even though there's a discharge position, getting full transparency via Congress is hard. Some Republicans, even MAGA line wing, are resisting. In the Senate, Republicans defeated a proposal to force a release via the defense bill. So, if it's nothing there and everything is so transparent, why do all these powerful men not want it released? Unless they're forced to do it. And that's what's happening now. They're having to be forced to do it. You're having to force your government to be transparent with you about something that you said you knew about, and now you don't know about. Or now it's a hoax. Be careful what you wish for, you'll get it. As things progress, Trump's primary change from I released everything to warning that people wanted to see might be misinformed or planted documents. That helps them deflect, especially if released documents don't contain a smoking gun his base might have expected. If that's the case, then release them. There must be a discussion because they haven't been released. If there's nothing there, then show us nothing there and we can move on. And why would you have went through this in the first place if nothing was there? The bottom line. Yes, the Epstein Files release campaign is real and was part of Trump's 24 campaign promise to keep players, Kash Patel, Pam Bondi, and the GOP side, Democrats like Ro Khanna and Jamie Raskin and Thomas Massie pushing for transparency. Why? It's about political leverage, accountability, and the perception of powerful people connected to Epstein were protected. What changed? When documents started coming out, most were not new to Trump, and allies scaled back the committed publicity. Congress is divided. There's a big gap between the promise and what's actually been released. Result: lots of public frustration from survivors, activists, and some parts of Trump's base. But so far, transparency has been much limited than people had hoped. Interesting, huh? So, again, grieving the loss of Coach Wayne College. And we need to be better. We need to be transparent. We need to demand that. So, November, Native American Heritage Month. Interesting, huh? Native American Heritage Month serves as a national moment for honor of the first people of this land and to recognize them their enduring cultural, political, and spirited contributions and highlights. We need to correct historical erasure and misrepresentation and stereotypes that have shaped mainstream American understanding for generations. Thanksgiving, right? For most Americans, the month becomes an opportunity to learn more deeply about indigenous nations, past and present, of the education, community events, and engagement. Native American art, literature, and activism is key. Many non-Native people use November to reflect the real histories behind American narratives, especially around Thanksgiving, to approach indigenous culture with greater respect and awareness. And the continuation of the healing. Generational trauma is still real, but so is generational strength. 25 narrative voices emphasize healing through ceremony, artist medicine, education is best medicine, reconnecting with the land, community-centered healing practice, restoring ancestral wisdom, the national families, and that's really important. Also, it's National Family Caregivers Month, providing physical, emotional, and logistical support to loved ones due to age, illness, disability, or cognitive decline. Often unpaid, informal, and taken. I don't think they're unpaid. I think they're paid in many ways you can't imagine. The care and of someone that you care about and their well-being. There's no price on that. You wouldn't even try. It's taken on out of love, duty, and necessity. Includes daily tasks, bathing, dressing, meals, medical support, cleaning, vacuuming, taking out garbage, advocacy, appointment, paperwork. Many caregivers don't see themselves as caregivers, which prevents them from accessing help or identifying their role as essential labor. The work is a mix of deep emotional connection and heavy responsibility, often affecting caregivers' own health and finances. Well, we'll be okay. And so some of the things the Department of Labor rollback proposed will remove overtime pay protection for many of the home care workers, reduce the income. So this is a big, beautiful bill. That's what it's going to do. Protected for many care workers, reducing income and weakening labor protection. Suspension of enforcement. In 2013, caregiver rules increased vulnerability for professional caregivers. Caregivers often face lost wages, reduced work hours, job instability, and long-term financial consequences, retirement delays, and debt. Again, caregiving. Public programs like Medicare remain uncertain. Funding cuts or restructuring would directly harm caregivers who rely on long-term care supports. And again, where do people go? If family members don't have the resources to take care of folks in home, where do they go? They have to place them. And then they say there's not enough room for placement. So there is a person in a revolving door, like homeless, like mental health in a revolving door, like incarceration in a revolving door. Many caregivers thrust into complex medical roles without training. I know that for a fact. Despite care coordination, mental health support remains inconsistent or insufficient. Stuff like physical therapy, exercise programs, getting the person out. It's hard. Society still tends to use caregiving as a family duty, not labor deserving of compensation or benefits. Caregiving remains invisible in public policy because many do not identify as caregivers until it happens to you. If you're young, don't worry. Your parents get old, don't worry. Your child may get sick, don't worry. Your partner may get sick. You become a caregiver. At a high level of stress, isolation, and exhaustion, limited access to mental health services or structured relief. Why National Caregiver Month matters, raises public awareness of the essential role caregivers play, highlights public policy gaps and pushes for national action, brings visibility to the emotional and economic burden carried by caregivers, encourages community support and advocacy for long-term sustainability and caregiving solutions. It's an ongoing piece. It's always morphing. It always changes. The Savage generation had parents on one side, grandparents on one side, and children in the middle. Squeeze. This is American Diabetes Month. American Diabetes Month observes every November in the United States, highlights the growing public health challenge of diabetes with particular focus on prevention, early detection, and management. In California, especially Southern California, diabetes prevalence mirrors national trends but is shaped by unique regional demographics. Prevalence in California. In Southern California, the mean prevalence of diagnosed diabetes among adults is approximately about 11.3%. For every 100 people, there's 10 people have diabetes. 10 people don't have. Closely matching the national average of 11.5. However, prevalence varies widely by census tracts, ranging from 1.4 to 33.6%. So, although the average is 11.3%, you can go into particular communities, and the discussion is, you tell me your zip code, and I'll tell you what you're going to die of, and probably when you're going to die. Definitely what you're going to die of, and what you're suffering from, and that is very clear. Highlands versus the Flatlands in Oakland. Although I don't know if that's changing. They're shooting folks in the skyline. So again, this gun violence is immeasurable. It's affecting all facets of society and life. You probably can't tell me you don't have a friend or a family member that's been touched by gun violence. Just can't say it. That's why it would kill me when certain communities say, well, this has never happened in my community. Well, because it was going to happen or it's been happening, you just didn't see it. However, prevalence again varies widely, anywhere between 1.4% in some communities and 33% in others, reflecting significant local disparities. Like in Los Angeles, the age-adjusted prevalence of total diabetes increased from 10.5% to 14%, with prediabetes affecting almost 4% of adults. This is diabetes. Let's talk about hypertension. Let's talk about cholesterol. Let's talk about hyperlipidemia. Let's talk about thyroid disease. Let's talk about cancer. Let's talk about pulmonary diseases, asthma, COPD, environmental exposures, flu, cold, and shoulder makes all these things worse. And you're talking about cutbacks now. Gender differences now. Men have a higher prevalence of total diagnosed diabetes than women. This pattern is consistent with California, although data says social behavior factors may modulate these differences again. And in people of color communities, it's twice that, 3 to 4 times that. I can't tell you the time I've had an older Hispanic, older African American. I'm 70 now, so older it goes from 50 to 60 and above. Not being treated, not on medicines, not on insulin, not taking general care, not having recent eye exams, not having recent foot exams. That's why in EPIC, which is the electronic health record standard right now. Before that was Next Gen. They have care gaps where people at a certain age point, prostate exam, PSA, A1C, hypertension checks, eye exams, foot exams, just general stuff. So age distribution, diabetes increases with age. Surprise! In Los Angeles County, adults age 65 and older have the highest prevalent rate in 1 in 4 affected by diabetes, and 1 in 2 affected by 2 diabetes. That's 50% of people. Key regional factors in Southern California: physical inactivity, lack of insurance, food insecurity, routine checkup are the strong correlates of diabetes prevalence, differing from national average, with obesity, food stamp participation, older age, and racial and ethnic minority status are more prominent in the large Hispanic population and Hispanic, and in general, people in general, but definitely Hispanic community, definitely African American, definitely Asian. Asians are underrepresented. In summary, diabetes prevalence in California is high and rising with the marked disparities by age, gender, and local socioeconomic factors. The most common comorbidities associated with adult patients with diabetes are hypertension, hyperlipidemia, overweight, obesity, chronic disease, cardiovascular disease, depression. Hypertension is the most prevalent comorbidity. Heart attack and stroke, affecting 82% of adults with type 2 diabetes, followed closely by hyperlipidemia. Right? Makes sense. Elevated blood pressure, elevated lipids, blocked coronary arteries, vascular disease, heart attack, stroke, inflammation. That's why a lot of the treatments are anti-inflammatory. That's why plant-based diets are anti-inflammatory. And one of the natural ways of fighting this is how you're eating. We eat too much salt, too much sugar, too much of everything that we don't burn off. We don't drink enough water. In California, Filipino, Pacific Islander, South Asian, Black, Latino, especially Mexican origin, adults with diabetes have the highest prevalence of comorbidities, particularly cardiometabolic conditions such as hypertension, obesity, diabetes, the whole prevalence. Interesting enough, Filipino adults consistently show the highest rates of diabetes and comorbidities, including hypertension, obesity, high diet and rice, pork, activity, hard workers, family orientated, good cooks. We got about 5 minutes left, and I want to say thank you. Believe Radio, 24-hour Universal Gospel Station. Thanks to all the folks that listen and take a listen and check out some of the stuff that I talk about. I try to keep sure it's relevant. The thing that I wanted to talk about in respect to diabetes, the GLP-1 have transformed the treatment and paradigm from type 2 diabetes. Their agents not only lower glucose, but also provide substantial cardiorenal protection, reduce all-cause mortality, major cardiovascular events, including stroke, with GLP-1s, heart failure, hospitalization, and progression of chronic disease, the SGLT2. They also promote weight loss and have a new and also put weight loss and lower the risk of low blood sugar compared to older ages. In summary, the clinical presentation of diabetes varies by type and treatment, type 1 versus type 2. Increasing individualized. The advent of GLP-1 and SGLT2 have shifted the focus from glycemic control alone to comprehensive risk reduction. And I just got a hold of a letter in regards to the GLP-1s, and it says, important Medicare member, due to in the 2025-26 state budget, your Medicare RX benefits will change January 1st to 2026. It was given to me by who we will not mention, but understands the issues with this, and I want to thank him. No longer will cover drugs for weight loss known as GLP-1 drugs. The list of GLP-1 will no longer be covered as follows: this Trulicity, Bernada, Mendoza, Ozempic, Wegovy, Lascelles, Mounjaro, all of them basically. And what did it say you should do? It says that there are many other options you can do with the water, such as diet change, increased activity, exercise, confidence, and more. Well, we know that it's just not a personal issue. It is an issue of genetics, environment, trauma, all the inability to have physical activity, that kind of thing. And the last thing I wanted to bring up, because it just kind of got me and I had to deal with it, is, well, I want to thank all the veterans for the service. And I'm a veteran. And again, Veterans Day, you have to go look it up. Important. And I want to talk about Thanksgiving 2027. What does Thanksgiving mean in 2025? For most Americans, if the national holidays center around gratitude, family, food, and reflection, increasing understood a day with complex seriousness not only of celebration, for many Americans, in 2025, a year of social division or economic stress, cultural reevaluation, calls for historical truth, which deepens the conversation around what Thanksgiving should represent. More people are using the day for the volunteer to support food justice movement, acknowledge indigenous communities, and reflect on America's past with honesty. In other words, Native Americans are the reason why we have America. And our lineage points back to people of color populating America before Americans. So the significance of Thanksgiving in America today, it remains one of the most important U.S. cultural holidays, a time for commitment service. It serves as a reminder to pause and reflect on what we crave despite national challenges, symbolize the American ideal of the community, hospitality, sharing, and abundance. But in 2025, there are more layers to that. Americans are thinking who was left out of traditional narratives and how history has been simplified or sanitized. Groups statistically neglected in Thanksgiving story, indigenous, especially the indigenous people, the Wagabi people, the story of police many much peace while their land and culture were violently taken, enslaved Africans and African Americans, and labor built early colonies but erased from the Pilgrim narrative. Other oppressed groups experienced the ideas colonial story, women and children were perspective with silence, not English settlers and diverse communities later, and should this simplified textbook version includes epidemic induced by Europeans, settler expansion, broken treaties, cultural suppression. Should Thanksgiving be renamed? What do you think? Some indigenous leaders, advocates suggest Indigenous Peoples Day or of Remembrance, National Day of Mourning, Day of Acknowledgement. The idea is to not erase, but to show gratitude and to tell the full truth. We got a problem with that, don't we? The 1620 gathering between Wagabi and Pilgrim was not a formal holiday, not a peaceful turning point, not the origin of national celebration. It was a tense, temporary alliance shaped by woman survival strategy after epidemics decimated the tribe. You know that? The people that saved them were wiped out by epidemics brought by those settlers. English settlers' hunger and lack of self-sufficiency. So without the Wagabi tribe, then the settlers did not make it through that first Thanksgiving. And learn how to teach the true history of the Wampanoag tribe, spelled Wampanoag, and other tribes that were important in the survival. I want to thank you for watching. Happy Indigenous Peoples Day. Tell truth to the folks that need truth told to them, and we'll see you in a month. Thank you.